Hi, everyone. I'm Kara Lovehart, and I want to talk about my upcoming CE class for licensed massage therapist called Restorative Touch Massage for Trauma and Chronic Stress. So, I've been a massage therapist since 2006 and licensed in 2012. And as far as my background, I work a lot with those who are highly sensitive in their nervous systems, who have experienced chronic stress, and who've gone through trauma. So, for the last 10 years of my practice, a lot of the clients that I work with have been experiencing those types of symptoms. So, in this class, we're going to work with understanding how chronic stress and trauma affects the brain, and most importantly, the physiology, the nervous system, and what we work with, the muscular system. So, in this class, we'll be learning about what trauma is, how it's defined, how it affects us as well, individuals in our practice, so we can avoid secondary trauma from working with clients who are very stressed. A lot of massage therapists can say that they can pick up information or sensitivities that they start to feel in the tissue of their clients, and they can get stressed themselves. So, self care and developing that practice will be a part of this class, but we'll also work with techniques not only for communication styles, bedside manner, our intake forms, questions we can ask on the intake form, staying within our scope of practice, so we can learn a little bit more about our clients' backgrounds. How can we make the environment safer for them to be able to have more of a therapeutic experience with us? After COVID, the pandemic, we've had more of a collective trauma. So, understanding how the nervous system works, and not only patterns in ourselves, but patterns in our clients, if they're in a nervous system response of fight, flight, fawn, or freeze, we'll be identifying those and what they look like in the nervous system and in the muscular system, how it affects range of motion, different muscle groups getting tight, and different techniques that we can use to help the body down regulate itself or come back online if people have been shut down or more disassociated. So you might have experienced clients, especially after the pandemic, coming in that maybe are more on edge, that are having sleep disturbances, that are more sensitive than before. And this could also affect your practice, such as maybe bad client reviews. And even if you didn't necessarily feel like you did anything wrong. So part of this understanding trauma and chronic stress, we can better show up with communication, the environment we provide for our clients, the techniques we provide to help really give this experience for therapy so that it can work with their chronic stress. Now, specifically, we will stay within our scope of practice, of course. We're not diagnosing, we're working hand in hand if we need to with mental health professionals and learning how to refer out. But most importantly, we have techniques that you'll learn in this class that are pressure points and massage techniques to work with different responses in the nervous system so we can help our clients better. So this class is going to be happening at Firefly Hollow Wellness Center, and you can check our online website for the upcoming class dates. But specifically, if you have questions about this class or you're interested, let us know, because I think with the trauma and the stress that we have in our society at this time, it's really beneficial for any massage therapist to have this understanding and background. Not only can you retain clients in a much more effective way, but clientele who have chronic stress, whether they identify it or not, because that's one of the things that we will talk about, self-awareness for ourselves as practitioners, but also having the self-awareness and the awareness of our clients and meeting them where they're at. Because I think that we've had a lot of people that come in to our practice that have said things like, I had, massage somewhere else and it was a horrible experience. And when we inquire, we ask, well, what seemed to happen? And these things that we're getting, is the feedback we're getting from clients, is simple things that relate to environment, to the intake, to helping the client feel that they have a sense of power and consent over their sessions. And these are simple things we'll talk about with language. So for example, we will say to our client, okay, now I'm going to put a bolster under your ankles or your knees. In someone who has perceived that have had trauma, if they perceive their power has been taken away, or it really has, the power of choice is usually taken away. And of course, we had the power of choice taken away for us as a society over the pandemic. So we will talk about different language we can use, such as, would it be okay if I put a bolster under your legs right now? Would it be okay if I utilize essential oils? And of course, there's a lot of things that are very simple that make a lot of sense when you understand when someone's nervous system is in high alert or high stress, whether they're aware of it or not, how utilizing language, intake techniques, consent, and forms of acupressure points that we can learn to use these to downregulate the system, get people more aware of their bodies, and helping them to understand not only what they're feeling inside the body, but what types of techniques work for them. And so that creates this more of a collaborative experience between you and your client. So this is a sure way not only to retain clients, keep them coming back, but really to help them in their process for downregulating stress, and maybe working with trauma if they're working with other healthcare providers. So if you have any other questions about the class, let us know, and we look forward to seeing you there.